This is Jon Lascher from Partners in Health Sierra Leone. Today is Monday, May 4th. I hope everyone's doing well. I know it's the second day of the 3-day lockdown in Sierra Leone. Since we last updated everyone on Friday, there have been an additional 42 cases of coronavirus confirmed in the country, bringing the total number of cases up to 178. Joining us today is Vamba Lolleh from our monitoring and evaluation team. We're going to hear a little bit more about his work getting electronic medical record systems deployed at Wellbody Clinic, and also hear a little bit about what he's been working on throughout the coronavirus epidemic.
Hi, John.
Hi, Vamba. How are you?
I'm fine. So, my name is Vamba Lolleh, and I'm the e-health officer for Partners in Health. My responsibility is to make sure we have our data collection tool being transformed into an electronic platform to get timely data to support patient care decision making. I've been with PIH from 2015 up to this time. It's a long time. I can say from day one.
So as an e-health officer, are you working at the hospital? Are you working at KGH, at Wellbody, or both?
I actually do support the different sites. I do sometimes work at the office, most of the time based at Wellbody.
Can you explain a little bit about those tools and what they capture and what your role is in rolling them out?
Yes. So as PIH Sierra Leone, we have basically two different tools we are using at the two facilities. We have Comcare, which is used for data collection at the hospital. Then we also have the EMR, which is deployed at the Wellbody Clinic. So an EMR is an electronic medical record platform that are mostly used at health centers. So when a patient visits a health center, you'll be registered through the EMR, and then your details will reflect directly to the people who takes the triage. From the triage, your information will be entered within the computer. From there, you'll be given a patient card. So basically what we are doing with the EMR now is to go with 100% paper-free at Wellbody. So from the entry point, you receive no paper until the pharmacy. So all you have to carry is your patient card, which is like an ID card. So at every point of the visit, they'll take that patient card from you and scan with a barcode scanner. Then that person, the clinician or the laboratory technician will see all the information that has been entered from the different points where you're from.
And how long has Wellbody been on this electronic system?
Wellbody has been on the EMR from June 2016.
Wow.
June 9th, to be specific.
And how many patients are registered in the system right now?
We have over 28,000 patients.
Wow.
Yeah.
And how has the process been from moving from paper registration to electronic? How has that process been?
Well, the process has been very smooth comparing like when we had like paper and like patients who come to the facility. There are a lot of like processes, like even like the clinicians were to write with a pen. That actually took them a lot of time to like see one patient. So now moving to 100% electronic, you see that like the clinicians are not using like pen. Most of like the things they are doing within the EMR are just like selecting different options. And even like moving to the lab, you find out like the time they used to spend to do one test, one sample have drastically reduced.
And can you talk a little bit about how your role has changed because of coronavirus?
Yes. So, well, I cannot say there has been like that small changes, because the good thing is we already had like systems in place. So what we are doing now is just to modify what we already have, because we've been using Comcare from 2015. And this is the tool like every organization is about to use now for COVID-19 response. And we've already been using Comcare for community screening using our community health workers. So we are basically, it's not that kind of a big change at the moment. So what we are doing now is just to do modification on what we had before to support the COVID-19 response.
And what are some of the modifications you've made?
Yeah. So we've added COVID-19 screening to the CHW application, which they've already started using. So at the moment, we have community health workers in every community screening people for COVID-19. We've also added that COVID-19 question to the triage application at the Koidu Government Hospital. Then we also have somebody with a tablet screening each and every patient entering Wellbody from the gate. So the first thing they do is to screen you for COVID-19 before you even enter the compound of Wellbody.
How difficult is it to add a COVID-19 module to Comcare?
I cannot tell how the difficulties, because this is something I have been doing for a very long time. So it didn't actually take me much time, because we are always using Comcare and we've always been doing different modifications. So adding those questions didn't take me actually much time.
And what about the training? Was it challenging at all?
Yeah, I think the challenging part was bringing all those community health workers from their different chiefdom to Koidu for the training. But like I said, the community health workers have been doing refreshers training all the time. So this is also a routine thing they've been doing, training them regularly.
Wow.
So what they did was to bring everyone to Koidu, and they are all trained on how to screen people within the communities. For the nurses at KGH, they were also I think they were only even trained one day.
What's the experience been like for community health workers and the triage nurses to use Comcare?
They are very okay with using Comcare, and because you can tell when you have issue with one of the tablets, they'll be very inconvenient, using paper or whatsoever system. And it makes life easier for them, because you are not writing and you collect the data. The moment you sync it, you get the output of what you've entered. And for the triage nurses at KGH, the application is actually also helping them to make decisions based on the questions they select. For example, if a particular patient has more than one or two symptoms, the application, the Comcare will tell you that stop here and call a clinician. Or you'll be informed that this patient is a suspected case. So that's the same thing we did for the CHWs as well. So once they come across a suspected case, they will know from the phone. The phone will actually indicate that this is a suspected case. Call 117 or call the district surveillance team.
And you had mentioned that other districts are using Comcare. Is it how far? I guess how many other districts are using Comcare?
Well, that's the difference. With Kono is at a very big advantage regarding the fact that we've been using Comcare forever. Other districts are on the preparation phase now. So we've actually been collaborating with other partners like CRS, World Vision, and we've been learning from what they want to do, and we also know exactly how far we've come from and what has been our implementation with Comcare. So as I can say now, we only have CHWs from partners in health that are doing community COVID-19 screening that I know of with Comcare.
And what's the future of the electronic medical record system and Comcare? What do you think the next few years will bring to PIH?
I think the future, for Wellbody, we are almost at the completion phase of Wellbody. So we're actually aiming at rolling that out to the Koidu Government Hospital, because as it now, Wellbody from registration up to lab and pharmacy, they are all using EMR, even at the delivery center and the ANC. So everyone is on EMR now, and that is exactly what we wanted. So what we are aiming for now is how we can roll this out to KGH and probably other chiefdoms as well.
How has lockdown in Kono been for you?
Well, I'm indoors. I haven't gone out since. I'm actually working from home from yesterday, and today I also been working from home. But actually, I can see that people are actually abiding by the rules that the government is giving, because you can see people using facial masks, and people are actually not on the street.
Yeah. What were preparations like for the lockdown for you?
Yeah, I went to the market, of course, and got some food stuff and came back. So that was just what I did. It's very kind of frustrating because we don't have light as compared to Freetown. So we only get light from 2 to 12.
So the electricity is only on right now
yes,
from 2 p.m. until midnight?
Midnight, yes, 12.
Wow. Yeah. And then it's off from midnight until 1:59 p.m. the next day?
Yes, exactly.
Wow. And are people on your team, are they afraid of coronavirus right now, or how are people feeling on the team?
I don't, there's nobody on my team that's actually kind of afraid of, because we have actually been on top of situation. For example, our clinicians have done a very great job. We don't have a case at the moment, but we always see the clinical leads are always on the radio, sensitizing people. Not only because anytime they are on the radio, we also listen and we get the message. Yeah. And even we have community health workers who visit different households. There was even a time when one of the community health workers even came to my place, and she never knew that this was actually my house. She came here to talk to me about coronavirus. So even within the communities, people know exactly how to prevent themselves from coronavirus now.
Wow. And what's keeping you motivated right now?
My motivation has always been providing care for the poor. As we know, we are all providing care for our patients within the community, and this is actually the time people need us most. So this is the time we also have to come together to produce our best, to give our best to our community and prevent COVID-19 from coming to Kono. Also keep giving advice to people who probably will be listening to this message that we should always try to be safe and make sure we wash our hands or use hand sanitizers. Just try to maintain preventive measures.
Yeah. Thanks so much, Vamba.
You're welcome.
Okay, talk to you soon. Thank you to Vamba and the entire M&E team. We'll be back with more audio updates this week. I hope everyone is staying safe during the second day of lockdown. Talk to everybody soon.